Well, Neil, actually, I think that the pharmaceutical industry should be thanking BP right now because their popularity ratings have been sagging over the past 20 years to the point where they're almost overtaking oil companies in terms of lack of popularity, with about less than half of people thinking that they were doing a good job and that they had a positive viewpoint of them. Now with the BP disaster, of course, the oil companies are probably sliding even further and keeping ahead of pharmaceutical companies. But I think there's a common principle going on here in that when you have a corporation, which is a group of people, and you don't have like one person who's morally put in a situation where you say, okay, I want you to decide that you're going to do this particular type of drilling where you're going to shave off $500,000 off the profit for the company, but it could put at risk the entire Gulf of Mexico. And if you had one person making that decision, they'd say, well, wait a minute, I don't want to be responsible for a disaster in the Gulf of Mexico. Let's have some safeguards. Let's put a brake on things. And instead, you have these companies that are these multinational corporations. They've got all these subsidiaries and subcontractors and people working for them, and nobody takes any responsibility. There's nobody that says, I'm the one who, the buck stops here. You have one guy who's the head of the whole corporation saying that I want my life back. And you had the similar thing with pharmaceutical companies where the whole company is focused around the goal of trying to make money off a drug. In the case of the drug I was talking about, they had a global safety committee, and after a while they replaced all the doctors with marketing people. So it wasn't about safety, it was more about trying to spin the negative news about safety in a way that didn't hurt their profits. And I think that people that work for corporations should take individual responsibility, and there should be a culture of promoting morality and of promoting the higher standards of personal accountability. I think that some of these companies, they get into this culture where nobody wants to be the one to rock the boat, and nobody wants to be the one who's going to say something that's going to potentially negatively affect profits. Everybody gets into sort of a herd-like mentality, and that can lead to things that, like the disaster with some prescription medications, or the disaster with the BP oil spill. Now, how you can get people to take more compassion, more accountability, I think that we just have to appeal to individual people. There's got to be some people in these corporations that are going to be willing to take a stand and say, no, we can't do it this way because there's too much of a risk. I think people are outraged over these prescription medication disasters. I think when the Vioxx scandal hit, and then it was clear about how much cover-up there was and how much payola, or paying people off, paying off doctors, paying off journals, all of the PR machinery that went behind this disaster of tens of thousands of people dying needlessly with heart attacks for pain medication. People were outraged, and that's why it was in the front of the news. And I guess it just takes more drug disasters, unfortunately, for people to realize that there's a potential risk there. But I think people are becoming more educated, and internet and people educating themselves has a lot to do with that. And I'm a firm advocate of health literacy and of people educating themselves to learn more about healthcare and medicine, the way that you've been doing with your books and your television programs for children.
Well, I think obviously you have put your neck on the line. You put it on the line when you weren't even aware that you were putting it on the line. And you almost got your neck cut off, but you didn't. Actually, instead, the pharmaceutical company didn't win that battle. I think there's an incredibly important lesson to be learned from your struggle. I'm just wondering, personally, was going through that psychologically devastating for you?
Yes, it was. It's very stressful to be accused of fraud even when you know you didn't do anything. These kind of legal proceedings can go on for months. To just be having attempted character assassination, to an attempt to discredit you personally and professionally. It's almost like you have to sort of give up your desire to retain your reputation or your professional career, because after a while, when it goes on for months and months and years, it's just it's very, it wears you down. It has an effect on your personal life. It's extremely stressful, and if I had known back then all the stuff I'd have to go through, I'm not sure that I would have done it over again. Although in retrospect, with the view that I've developed of what really goes on, behind the scenes and the promotion of these billion-dollar drugs, I think it's a discredit to the American people to turn a blind eye to it. And I think it's wrong as a doctor. I took an oath, the Hippocratic Oath, to above all do no harm. There's nothing in the Hippocratic Oath that said anything about make sure to not forget to promote the products of the pharmaceutical industry. So that's where my priorities are.
Do most doctors who meet you and know what you've done pat you on the back and say, we're really glad that you're doing this type of work?
No, I'd say not. I think most doctors that come, there's a lot of doctors that will get a copy of my book given to them by a patient. Sometimes I've heard that they become angry about what I've written. I had a couple instances where I had some doctors who were writing blogs online come and personally attack me, and I had to carry out a kind of an online debate with them about some of my views. The only time I was asked to give a lecture at my university about medications, the head of the hospital called me and said, well, why are you doing this? And I said, well, why don't you have another doctor come and debate me? So it was this sort of bizarre thing where I had a half hour to talk, and then he had a half hour to talk, and it was like a debate or something. Some people, I think the problem is that people don't want to admit that a drug that they're giving that they think should be helping people can actually make people worse or can make people die, and nobody really wants to accept that. I did meet a doctor in France, though, who had prescribed this medication. The boy had killed himself, and she allied with the family because she realized that the company had not adequately warned her of these potential risks, and so she became an advocate for the family and worked with them to try and to change this and to try and get some legal redress from the family. And I think it's this pervasive culture that we're somehow supposed to be partners with the pharmaceutical industry. We're not supposed to say anything negative about the industry. And we get a lot of dinners. We get paid to give lectures. They've controlled the top of the medical establishment, the academic medicine. They even have companies that you can hire, that drug companies can hire to manage, as they describe it, their key opinion leaders, who are the people doing the research who other doctors are going to for education and to learn more. And so they're controlling that flow of information in a way that they've learned is very effective, and they've gotten very good at it over the years. What it means that more and more people are going to be taking prescription medications, and in some cases it's going to not necessarily be in their best interest.
Well, I think you are sort of a role model for advocacy for patients, and Doug Bremner, as a physician, professor, and researcher, I at least want to thank you.
Thanks, Neil. It's been great getting to know you, and look forward to working with you in the future.